Welcome back to Wellness Wednesday. We've been talking about the heat all morning, and while it can impact anyone, older adults face an even greater risk of heat-related illness and dehydration. Join us with simple ways to stay safe and healthy this summer is Rachael Rivero from Kansas Care Connect. Rachel, thank you so much for being here.
Yes, of course.
So the summer weather finally arrived, and I know that people are probably tired of it because it's hot outside.
Yes, our summer heat finally showed up.
Yeah, no, definitely. And I know with summer heat, we have to stay safe, especially those older adults.
Yes. So older adults are just a little bit more prone to heat-related illness. As we age, our body just changes how we can respond and adapt to that heat. And then older adults are also more likely to be on medications like blood pressure medication, if I can speak, water pills, diuretics, even allergy medication and depression medication, mood type medication that people don't often think about. It changes how your body reacts, and you're already kind of fighting that natural aging process anyway. And so they're just at much higher risk of having issues and not realizing it until it's too late.
Yeah, definitely. And we hear the typical things, you know, drink water, wear sunscreen, stay safe out there. But what can people actually do to help prevent those types of things?
So I think the best thing is always, you know, we plan for events. If you know you're going to be doing something, plan for the heat as well, right? You're not going to escape it. We live in Kansas, it's hot. And so making sure you incorporate the planning of that. So if you can avoid being out in those prime times, obviously, if you can't, then plan for it. So of course, have your water, but also try to take something so you can be in the shade, have a fan to help with air movement and keep you cool. Make sure that you give yourself breaks if there's somewhere you can go in and get some air conditioning. If you're having a lot of recurrent issues with heat intolerance and you are taking some of those medications, of course, never stop them without talking to your healthcare provider, but definitely have that discussion with them maybe next time you go, or give them a call and say, hey, I'm really having a lot of issues with heat intolerance and I've had a lot of issues because I'm worried about it might be related to my medication, and is there something we can adjust or change it to, or do I even still need to be taking it, and see if that discussion, you know, can help. And but also just make sure you're planning for it. Try to avoid it. Wear, you know, lightweight clothing, all the things. And then if you're just a family member or a friend or a neighbor of an older adult, when you're dealing with these hot temperatures, an important tip for them is just check on them. Check on your loved ones. Check on those people who are more susceptible. A simple phone call can really do wonders. So if you check on them and they're feeling kind of off, maybe they're a little confused or they're more tired or complaining of hurting more, maybe muscle cramps, dizziness, things like that, those are early signs. So that's maybe a cue to, hey, you need to drink some water, stay out of the heat, maybe call a family member or have them notify their healthcare provider or something like that.
Yeah, and things can happen in a matter of minutes, definitely.
Very quickly.
You know, is there like a hotline or anything that people can call just in case if something does happen?
Always, if you're concerned about heat-related illness, 911, you know, faster emergency care, but definitely there's different, depending on who your doctor is, you know, there's different hotlines that they can use directly tied into their medical team, because those are the people who know you best. And so those are the ones I always recommend. So just knowing what those resources are and knowing which numbers to call. And then if you do have a care team like Kansas Care Connect, you can always call us as well, and we can be that direct point of contact and help navigate that situation.
Definitely. Well, thank you so much, Rachel, for being here and sharing all the tips all around safety.
Yes, thank you for having me.
Of course. And hey, to rewatch this interview, just go to cake.com/guest. We have more safety tips there. We'll be right back.